April is Esophageal Cancer Awareness Month, and a new study finds a growing number of people under the age of 50 are being diagnosed with the disease. In tonight's Health Beat, we spoke with a doctor at Dell Medical School to find out why that is and what to look out for.
In the last few years, many of us who have been in practice for a long time, we started seeing patients with cancers at an earlier age. So we were already seeing this thing in clinical practice.
Now, a recent study by the American Association for Cancer Research gives further credence to what doctors like Deepak Agrawal, medical director of digestive health and chief of gastroenterology at Dell Medical School, have been dealing with. Researchers looked at 34,000 cases of esophageal adenocarcinoma tracked in a national database from 1975 to 2015.
It was a very elegantly done study, and they looked at a lot of patients, and they actually proved that esophageal cancer is happening at an increasing rate in younger population. And when I say younger, in the study they looked at younger than 50 years of age.
The study found younger patients were more likely to be diagnosed with late-stage cancer. Dr. Agrawal says there can be several reasons for that. Younger people tend to ignore symptoms, and doctors might not suspect cancer earlier due to their age. Or if it's genetic, the cancer could be progressing at a faster rate. Esophageal cancer is also more common in men and Caucasians. Other risk factors include smoking, obesity, especially when extra weight is carried in your stomach area, and diets high in processed foods.
These are all associations, and there are no causations. But needless to say, I think it's time for us to start paying more attention to our eating habits.
Another risk is chronic heartburn or acid reflux, known as GERD. That can lead to a condition called Barrett's esophagus.
When the acid comes into the esophagus is not used to it. So the cells get damaged, and then they repair themselves. And this thing happens again over, every day over years. And eventually some of these cells can go rogue, and then they may transform themselves. And then that's how a cancer may develop.
Other red flags include difficulty swallowing, weight loss, low blood counts, and family history of cancers of the upper GI tract. And if over-the-counter antacid medications don't help with acid reflux, see a doctor.